Hello, everyone, and welcome to the first ever Bedside Murmurs podcast. We have a great show lined up for you guys. Today, joining us will be Professor Les White. He is a pediatric oncologist with Sydney Children's Hospital. And also joining us today is Louise Breheny. She is a faculty member with UNSW Medicine and Health. Louise, would you like to give Prof. White a quick introduction?
Thank you, Orko. It is with great pleasure to introduce Emeritus Professor Les White here today to Bedside Murmurs. Emeritus Professor Les White AM was the inaugural New South Wales Chief Pediatrician, Executive Director, Sydney Children's Hospital, and the John Beveridge Professor of Pediatrics. He champions the engagement of children in healthcare. His research and advocacy interests include childhood cancer and networking paediatric services. He has had a 5-decade clinical and academic career, contributing to over 140 publications, underpinned by many awards and grants. In recognition of Professor White's significant contribution, he has been awarded the Order of Australia for service to medicine and the community.
Thank you very much, Louise. That was a very impressive resume. I would hire you for every job that I'll ever post up. Now, so clearly coming on Bedside Murmurs is probably the highlight of your career. Is that right?
Pretty close.
How's your day been so far? How are you spending time in quarantine?
Well, fortunately, I've been kept very busy with some very major projects, which I can do online. So, yeah, plenty of work.
That's great. Any of the projects that you're allowed to share with us?
Well, there is not a secret, but I'm doing a review of another children's hospital elsewhere in the country, which I can do online, and it requires a lot of work and a lot of reviews of documentation and discussion with people. So that's a fairly substantial piece of work.
Great, lovely. So let's jump into the interview. Pediatric oncology, for med students, it's not usually the first field that a med student would come into med school thinking that they want to go in that field. So I would love to know what would be some major influences that contributed to your career path, and if this was something you anticipated you would end up in when you were in med school.
Right. Well, first of all, may I say good afternoon, students and other listeners. Thank you for inviting me to this podcast. Looking back, my career has been long and rich and diverse, and many of those things were not anticipated. Some were planned and some were very much subject of opportunity. I'll give you a couple of examples to sort of set the scene, and we can then go from there. But here's an example of something that was very much driven by opportunity. Once I finished my general internship and residency, I did decide I liked children's health in particular. I wanted to do pediatrics, but I also wanted to do a bit of travel. So I ended up with a locum position in London, at a London hospital, doing some pediatrics. And suddenly my mother took ill, had to rush home. She needed major surgery. She was at Prince of Wales. I was visiting her, and I ran into an old student colleague who I'd been through uni with. And keep in mind that I knew nothing about the Prince of Wales or the precinct, because I'd been a Sydney Uni student and all my experience has been in hospitals on that side of town. And I told this guy my situation, and he said, "Oh, look, they've got some pediatrics here." So I went and visited the department, met the guy who was in charge of medical staff, told him of my situation and the fact that I was potentially available for some short-term locum employment. He told me that my timing was good because they'd just lost the resident and they had a big hole in their roster. And he made a couple of calls, got my credentials and referees checked out, and within an hour I was offered a position. Now, that I then stayed with that organization for the next 47 years. So that opportunistic incident was rather career defining. And in fact, for some 17 of those years, I was in charge of the organization of the Children's Hospital. So that's one good example of being responsive to opportunities. If I give you the other type of example where you really have to think through the options, the pros and cons, the logic of it, and literally make a list of things for and against the decision. When later, when I started training towards children's cancer at the Sydney Children's Hospital in Randwick, it became clear that I needed to also spend some time at a large program elsewhere, and the United States was the most obvious. So I looked at the programs, and they had no less than 30 potential programs available to me. So there was a lot of decision-making and logic of picking one, depending on so many factors of what they had to offer, and including, to be honest, where you chose to live, which city in the United States. So I ended up working at Children's Hospital Los Angeles for the subsequent 3.5 years of that particular decision. So there's two examples of quite different forks in the road. And what I would say to the student colleagues is that there are many decisions and forks and milestones in the career ahead. And as daunting and as challenging as they may be, there really is no wrong choice. At the end of the day, once you throw yourself into a choice, or you made your choice, you throw yourself into it, you become increasingly knowledgeable, committed, engaged in that particular professional direction, then the passion grows and the rewards follow. We all want to make a difference in some way, and there are, fortunately for us in medicine, so many ways we can make a difference. So that's my reflection on choices made along the way.
Yeah, wow, that's a really great story. Now, from a med student perspective, the field of pediatrics in general, when you go into your first clinical year, so I was fortunate enough to have already completed my pediatric term in third year. It was also the first time that we actually properly went into wards and actually interact with patients for the first time. And children especially can be a little intimidating to talk to because the communication skill set is very different. And it's something that's not very explicitly taught to us in our earlier years. What would you want medical students to know about interacting with children in the hospital setting?
Great point you make. But let me just do a little bit of introduction. Firstly, I would acknowledge, interestingly, that as a student, even in those early years, I already became inspired by the opportunity to work with children. So I picked that up as a student, and it stayed with me ever since. But also, I'd like to highlight the importance of children's healthcare. I would argue children's health and well-being is a pivotal underpinning of societal success. It is the future of our society. So if you're looking for importance, I would argue nothing's more important than children's health and well-being. At the same time, it's extremely rewarding. Working with children is fun, it's inspiring, but it's also very rewarding. It actually will carry you through a career of 5 decades, as it has in my case. Now, coming back to the very important question you raised about the opportunity you have as a student. I used to make a point of saying, don't miss this opportunity. You get allocated during your terms to spend time on the wards and various clinics. And you should grab every opportunity to interact with children in an informal setting, become comfortable with it. Then there are medical aspects, of course, that follow. But just the comfort, as you describe it, of communicating with a child, examining a child, extracting relevant information so he can be helpful. These things are learned from practice. And I think it's a terrible waste to miss it. And let me tell you that it shows up. And when you do your final exams, that I've still to this day examined occasionally, you can tell who's comfortable with children and who's not. And beyond that, in your various careers, if you're in a clinical field, and of course there are many fields, and you do examine children occasionally, it'll be very helpful if in these early days you became comfortable with that experience.
Right. Great advice. And on the topic of communication in pediatrics is a very unique field in that you're never only treating one patient. You have to manage expectations of the patient. You also have to manage expectations of the parents and potentially other family members. How do you, in your practice, traverse that field?
Well, it's a fascinating point you make. Let me first acknowledge a very interesting sort of dichotomy. There are in medicine, we have both the science, which is absolutely astounding in terms of its progress and its scope. The science of medicine is amazing. But at the same time, we have the humanity and caring side. And I would argue one should embrace both. Now, on the caring side, it's important to learn to engage, to communicate, to listen, and all of this with compassion and empathy. Now, that's common to healthcare in general. In children, there's an additional dimension, as you say. Well, firstly, I would say, as I think you pointed out, is that when you're looking after a child, you're not looking after the illness only, you're looking after the child as a whole. But then you have the dimension of the whole family, the parents, those who care for that child in whatever structure that family happens to have. And the family becomes both recipients of care as part of this broader concept, but also partners in care. So you have this amazing partnership. And I think that is critical to good children's healthcare.
Now, you published a paper in 2020 talking about the rights of children and young people in healthcare and how often it is quite poorly implemented of the right of the child to be heard and taken seriously. How do you think doctors can make sure that the knowledge to enable children to have age-appropriate participation input is put into the healthcare system and therefore have them have a say in their healthcare?
Yeah, good question too. So my interest in the rights of children in healthcare goes back a couple of decades. It started with an international collaborative which was studying this in various parts of the world. And then bringing it home to Australia, we established a collaborative group, which I led. And then we did a survey of current practices around hospitals. And as you point out, there were some gaps. We then published the Charter for the Rights of Children and Young People in Healthcare, which to this day is widely used. But subsequently became particularly interested in the engagement of children, or the voice of the child, more specifically, to put a pointed headline on it, the extent to which children are engaged and the extent to which they participate in decision making and are fully informed in the process. And that has led us to a whole other body of work, which literally is about to be published as a major report of how we manage that around various facilities around the country. And it's worth looking at quite seriously. And then the next phase out of that is there's a broader movement in healthcare generally to understand the patient-reported measures, both experience measures and outcome measures. That's become a very hot topic. And of course, applying that to children is challenging. So we do apply it as part of adult medicine, almost the parents and parental view. But now we're looking at directly engaging children of various ages with age-appropriate mechanisms to ask them what are their particular concerns, interests, and feedback. So that project is a national project currently taking off, and it aims to create a standardized approach to patient-reported measures in children of various ages.
Very, very interesting stuff. Now, pediatric oncology happens to be the field you have spent most of your career in, and pediatric oncology, at least from my perspective, and I would assume from a lot of people in my position of being like in the clinical year med student, pediatric oncology seems like the toughest field to be in, surely simply because of the emotional resilience you have to have for that field. How do you have the self-determination, and how do you balance the grief and the emotional aspects of pediatric oncology in your everyday practice?
Yeah, it's a valid question. Coming back to my earlier comment about the reality of science and humanity, is that I think children's cancer exemplifies that brilliantly. Just to dwell for a moment on the science, if I may, that the way the science of cancer and childhood cancer in particular has progressed is just mind-blowing. We are now focused on the molecular basis of cancer. We are able to, both diagnostically and in terms of treatment, tailor or personalize that to the individual genomic variations of that particular cancer in that particular child. That is an amazing piece of science. Along with that, we have this massive explosion in technology of diagnostic tools. We have drug development, which is amazing. And of course, mustn't forget the information technology of big data, which allows us to really track things on a large scale. So that side is brilliant. But you point out there's the human side of childhood cancer, and that is challenging but extremely rewarding. Imagine the relationship where you meet a child at the age of 3 with a newly diagnosed cancer. You get to meet the family. You live through them, through ups and downs. Sometimes it might end in tragedy. Most of the time, you end up lifelong friends, and that person grows up to become an adult. And I've had the privilege of being invited to weddings, of being introduced to the children of my ex-patients, and reflecting for a moment on my retirement, when I had a rather large retirement party in 2016, lots of my patients came. One of them spoke very eloquently, and a large bunch of others sent video messages. So that relationship is amazing. So yes, it's challenging. Yes, there are bad days, but the good days far outnumber the bad days. But the personal rewards are just astounding.
And especially the progress of cancer, I would assume the prognosis of any type of cancer is getting better by the day. So
absolutely.
Now, Australia is also a very culturally unique country in the sense that it has a lot of them, and it's also very linguistically diverse. And combine that with pediatrics, it's an immense amount of complexity that adds an entire family dynamic. What do you think is the most important way to address this and provide culturally appropriate and sensitive care?
I think it's an important point. I think we have studied this. We have a very culturally diverse country, and cultural competence should be part of important medical student teaching. It certainly is part of continuing education among health professionals, medical, nursing, allied health. It is an essential part of relating. And in particular in childhood, you make mention of this, the understanding of the parenting culture, the way that may or may not be different, and the nuances of it is important to understand if you want to be effective as a child health specialist. But may I add another dimension which goes alongside of that, which is that of inequity and disadvantage. And this is something I've emphasized in my student lectures over the years. Vulnerable children are a very important challenge to us. And of course, the most well-known example is Aboriginal children. But there are other dimensions of vulnerability, which could be socioeconomic, could be demographic, geographic, and of course cultural, as you pointed out, and could also be related to the parental health or mental health. So there are many reasons why children may be at a disadvantage or may be vulnerable, and that is a challenge we have to continue to work on, because we want all children to get the best of healthcare and the best outcomes.
Absolutely. So coming back to the topic of grief and delivering bad news about a patient who is a child, particularly to family members, can be incredibly challenging and can be quite daunting, especially if you're early in the medical career. How do you go about it? And would you have any tips you would like to share?
That's a very difficult question. I have found that something that I have taken on as an important part of my role, particularly when I was involved in caring for children with cancer and their families. But I would argue that I continued that same attitude when I was in charge of the hospital, because there's sometimes a need for the hospital chief executive to meet with a family who've been through a particularly difficult time or grief or even an adverse event. So the notion of connecting with families like that remains an important part, and many of us will need to deal with it at some point. I would say that I seem to have a natural kind of empathy that I feel and I understand I try to feel and understand where they are, where their grief is, how they feel. I don't claim to fully understand it. I think that that's not correct. But empathy means you try and put yourself in their shoes and feel their pain. And of course, the word compassion comes up. But the skill in communicating and listening and being there and connecting, these are things that are partially inherent. I mean, some of us are better at it than others. But like all things, they can also be learned or can be learned to be better at. So there are courses, there are tutorials, there are opportunities for practicing and learning those skills. And of course, it's quite unfair for a student or a new graduate to be thrown in at the deep end, so to speak. The best thing to do is to watch others who are experienced manage that particularly challenging reality. But it is part of our world, and I think we do need to be willing to deal with it and be part of it.
Absolutely. Now, were there any particular strategies that you employ when breaking bad news?
I think it would come back to that openness and that empathy and caring and openness to listen and share and be vulnerable. I mean, there is something about being vulnerable, sitting alongside of them rather than talking to them as a professional with no other connection. And these things are difficult to describe. And it's not the sort of thing you simply spell out or give instructions about. It is something you demonstrate, you show colleagues how to do, and you learn from experience.
Yeah, absolutely. Now, another aspect of medicine is teamwork. Now, teamwork, for at least from a med student perspective, it almost becomes a jargonic term nowadays because it gets thrown around a lot in your assessment criteria, and it gets thrown around a lot by your lecturers and your facilitators and stuff like that. Do you have any particular insights into the teamwork skills that are important to a healthcare team?
Well, I do regard teamwork or working in teams, as I've put it in other places, as an essential component of our professional lives, but also many other aspects of our lives. That's our current reality. I would argue that the age of the heroic individualist is over, unless you're watching it in hero movies. The reality is that that's not the way we operate successfully and into the future. So I would put to the students listening that is one of the most important and useful experiences I can share with you, that of all my achievements over the years in the various domains of my endeavor, it's always been dependent on working in teams. That's been what's made it possible. Now, sometimes you have to recruit, nurture, and support teams. They don't just happen. But whatever opportunity there is, whether you generate it or you just participate, it is essential. And so you ask, what are the attributes? Well, there are many, but they're overlapping. So if I list a few words like trust and transparency and empathy and respect and connectivity and collaboration, openness, shared vision. Now, there's a lot of words there, but there's broadly describe are conducive to a culture in which teamwork flourishes. They're the sort of attributes that I would list as leading to great teamwork rather than just ordinary or good teamwork. I've studied also the evidence, and I would argue that there's good evidence that in healthcare, working within teams delivers better outcomes.
Yeah, definitely a very interesting perspective. In terms of teamwork, an essential part of a team can also be the leadership of that team. And you yourself worked as the executive director of the Sydney Children's Hospital for 16 years. What prompted the move from medical admin from a more clinically based role that you were previously entailed with?
Interesting question. That's another example of that one I mentioned earlier about opportunities arise and you have to consider them at short notice. So I was very happy as a clinician with my specialty of children's cancer and as an academic at the same time with a broad research and teaching program. And then there was an organizational crisis and someone needed to step up and consider leading. I thought about it and applied for the role. And once I was offered it, well, of course, everything changed. I then moved into various leadership roles through that and after that. But I would add to that mention the point that we all want to make a difference. When you take on one of these roles, it does allow the opportunity to make a difference on a larger scale, in a larger scope. And that too is very rewarding. So there's no regrets. I think it was an opportunity that came up somewhat unexpectedly, and it has had an enormous influence on my subsequent career. But I am privileged and grateful for the opportunities it has provided me.
Great, lovely. Now, medical admin is, I suppose, a field that in a lot of careers, it seems like a very logical step, but something that med students don't really get to experience or think about. What was your experience in medical administration like?
Well, there are many formats or ways of doing medical admin. You can do it part-time, you can be a department head and still be a full-time clinician. There are lots of ways of doing it. I would add it to the spectrum of opportunities. Like I made the point at the beginning, and I would reiterate now, that one of the attractions of our field is that we have so many choices and so many ways we can engage and make a difference. And stepping up and managing or administrating, even before you get to high-level executive leadership roles, is a very important part of the system. Now, again, maybe this is a good time to mention it. There are some skills that some of us are more comfortable than others in those roles, and there are attributes that we bring to it. But as with all things, there's also an element of learning. So don't assume that you've got the right skills, you can just step up and do these things. Like we would never assume any clinical skills are just born. You have to learn them. And there are specific education courses for management and administration and leadership. There are specific colleges dedicated to it. There's lots of literature on the learning of that particular skill set. So yes, it's a combination of some personal attributes, but do remember that too can be learned and should be learned.
Absolutely. Now, speaking of leadership skills, what would you like med students to know about who are trying to develop their leadership skills, and any advice for them?
It's an interesting overlap with the earlier question about teamwork, and I'll tell you why. Firstly, there are many styles of leadership. So the style that appeals to me is a collaborative, inclusive, distributive style. So almost by definition, I'm going into the team concept. So I would say that a lot of the attributes we've been discussing that make for great teams are also the attributes of a leader in that context. But in addition, a leader has particular roles in setting strategic direction, in creating and sharing the vision, in engaging stakeholders, both internal and external, and defining the culture. So these are particular roles which are highly responsible, but they engage with a broader construct of collegiate teamwork.
Some great advice. Now, in your very fruitful career, you also served as the New South Wales Chief Pediatrician, a role involving public health policy. Now, policy is a personal passion of mine. It's something that I'm heavily involved in with organizations like Australian Medical Students Association, and something that a lot of med students are really passionate about as well, especially in today's time, where I feel like public health policy has gained a massive fan following over the last 2 years. What advice would you have for students who want to get involved in public health policy specifically?
Yes, a good, interesting choice. Now, can I just point out, just to reflect back for a moment, and this kind of dovetails into your question, that the leadership notion, there are many variations or forms of leadership. We've described a positional leader role and talked about some of the attributes and learnings, but there's also professional opportunities for leadership and personal opportunities for leadership. And I say this because many of the student colleagues will have opportunities to step up and lead in various ways. They might be very good at their work and inspire others in a professional context, or they might have a personal following because of their skills and particular charisma. There are many ways to become a leader, and positional leadership is just one of them. And then there's this dimension of wanting to influence the system professionally through public health roles. And I think that the terminology is a bit confusing, because I come back to public health as a specialty, but there are many system roles, so to speak, where you step up and take an interest in the health system as a whole, whether it's within an organization, as you described, whether it's within your own hospitals, or actually the broader statewide or national health system with official roles at the ministry or the Department of Health or whatever construct that particular jurisdiction has. They're all variations of contributing to good healthcare. And people will vary in their interests, but I would agree with you that, like I mentioned earlier, the capacity to influence things at a higher level and make a difference in a larger scale is an important one. And it also is very rewarding. Now, can you mix it with patient contact? That's a variable answer, depending on what job you take in what particular configuration. But sometimes you don't need, or you move on from patient contact, as I have done at the latter part of my career, to something more system-wide. But then the word public health is also a specialty. And I say that because that particular specialty of epidemiology and public health has become extremely high profile in recent months, as you know. So now we all know who are the state experts on public health and epidemiology. And that specialty has become a very exciting and highly admired one. So there's another interesting shift that hasn't always been the case, but it certainly is at the moment. The public has a very good understanding of the importance of public health and epidemiology as specialties.
Yeah, absolutely. Now, particularly with policy, whenever I'm in any kind of policy, it is a big challenge to manage all the stakeholders and make sure that everyone leaves the table happily. Do you have any advice or any particular experiences you had difficulties with, or you overcame the difficulty of managing all the stakeholders?
Yes, well, certainly I've always valued it enormously and put such emphasis on it that through that effort, it's tended to have worked out. I have recognized the importance of engagement. I've recognized the essential nature of alignment of stakeholders and being on the same page, and also acknowledging and understanding their side of it. They may have a different point of view. I think that degree of empathy, of understanding where someone else stands and what their issues are, is a very helpful one. But ultimately, if you take the time to engage and connect and recognize the importance of that, it will pay off. And it's something you cannot underestimate.
Now, the common saying that gets thrown around, at least in the political sphere, in terms of negotiation and compromise, is that if all parties leave the table unhappy, then the compromise is probably a good one. Do you find any truth in that statement?
I think that's a political statement. I can accept that life is a balance. And in fact, I was going to say a few words about it. I might as well put that now, that there's always a balance of views you have to take on board. And I don't have much room for extremists in my thinking. I'm very interested in encompassing the whole range of opinions, views, and even evidence, because sometimes pieces of evidence are perfectly valid, but they stand in contradiction to each other in terms of decision-making and policy. A good example is currently the clarity of what is good healthcare with COVID, contrasted with the challenges of managing the economy with COVID, both valid, factually based realities, but a balance has to be struck. So I digress, but I just recognize that balance is central to managing the spectrum of views and opinions. So sometimes when you reach consensus, almost by definition, it doesn't align perfectly with any single individual's view, but it's a best fit of what might bring people together. Now, I wouldn't put it like everyone walks away unhappy. I think that's an extreme position I wouldn't be keen about. But I would recognize that the balance has to be struck, and the skill in achieving that balance is an important one.
On the topic of balance and balance of opinion, it would seem, with what the media is showing us, that the polarity of the extremes of opinion have never been further apart. And it's also, I feel, partly because that we have so much access to information that it can be really overwhelming, and therefore it's almost easier to just fall to an extreme. How would you go about achieving a balance of opinion in today's world?
That's a difficult question. But look, I think there's a couple of things I would say that's just from my personal experience. Is firstly, don't tune into just one aspect or view of things that happens to resonate with your own, because all it'll do is reinforce your own thoughts. Stay open and interested in views expressed by a range of sources. I would add to that, however, is do have a critical perspective of how credible that particular source is. I don't mean dismiss it because it doesn't align with yours, but do ask the credibility and the evidence based of that particular source of information. So that's challenging, but it's important to practice. And if you do listen to a range of reasonably well-based views, you will strive towards a balance. Sadly, a lot of people having achieved or having reached a particular perspective, all they want to do is hear more of the same and simply refuse to listen to alternate views. That I discourage, but sadly, as you point out, it's become quite a recognized phenomenon.
Talking about public opinion and specifically public opinion about healthcare, nowadays there seems to be growing mistrust of the healthcare system in certain aspects, especially given the topic of vaccinations and COVID. Would you be able to give any insights on why that has happened to be the case, and how can medical practitioners go about trying to help that issue?
Well, the way this pandemic has evolved has created a lot of differences, which are not so much based on the information before you, but the background from which you come to that information. So you will see an alignment between people's political views and their stance on vaccination. So it's not the sort of thing I can address from a strictly medical point of view. You have to understand the diversity of beliefs and the alignment of philosophical views with how then you receive this information. And there has been, with the uncertainties of this pandemic, changes in views, evolution of views, new science. And some people just find that very challenging. That you said this last week, but now you say something different. We're used to change. We're used to recognizing that the evidence evolves and we adapt accordingly. But lots of people find that challenging, and they might consider this to be a deliberate deception. So there are all sorts of challenges, and I think we could spend at least another hour on this subject. But I think as medical practitioners, we have to be very up to date with the latest evidence. We have to be very capable in communicating that information to our patients and friends, for that matter, because people listen to us. And also remind everyone that the choice to vaccinate is not strictly about what's best for you as an individual. It is ultimately what's best for the community as a whole. And that dimension needs to be recognized.
Absolutely. Now, you served at the Sydney Children's Hospital for over 40 years. What would you say was the greatest change to medical practice you saw during your career?
Hard to pick one, but I will tell you, it's been an era of amazing change, absolutely amazing. And if I just step back to children's cancer for a moment, you mentioned outcomes. When I was a medical student like yourself, children with cancer inevitably died. It was a death sentence. Now we have cure rates of around 80%, and we are still addressing many challenges, but that's an era that so in terms of science, it's been an amazing era of change. Picking one, impossible. Recognizing the magnitude of it, very possible. And at the same time, I talked about the humanity, the care. Look how that's evolved. When I was a student like yourself, visitors were rarely allowed. There was very limiting visiting hours for children. Can you imagine how challenging for a child to be separated from their family in a hospital? And what a daunting and scarring experience that would have been.
Why was that the case?
Well, it was just tradition. I honestly can't tell you why people thought that was right, but that was the tradition. You were in hospital, we will look after you. Well, the parents sometimes can come in, but for very limited periods. But that changed. Things have evolved. And now we talk about, as we did earlier, the engagement of the family as a partner and as a recipient of care. True teamwork, that teamwork that we talk about within healthcare, it's also with others, other agencies and families and so forth. So the change in science has been mirrored by the change in humanity. And it's just been humbling to be part of it. but I certainly can't pick out one for you.
Yeah, no, fair enough. Seems like a era of great change.
It is.
Talking about change in the pediatric field, what changes in the pediatric field would you like to see in the future?
Well, I did mention my anxiety about inequity and disadvantage vulnerable children. So if I was to paint kind of a vision of what I'd like to see happen, I'd like every child, wherever they live or whatever their personal circumstances, to get the best of healthcare and to grow up happy and healthy to achieve their full potential. That would be a dream worth aspiring to.
Sounds like the perfect world. What do you think would be some good steps to put forward that change or start that change?
Well, there's a lot of things happening. I must tell you, there's a lot of both statewide and smaller projects and programs that are recognizing inequity and addressing it. There's a lot of work in early childhood going on, the first 2,000 days. There's a big project I'm aware of, which is associated with your university and the Randwick campus, to do with prioritizing children who are from disadvantaged backgrounds, who are vulnerable to more access. There's recognition in terms of policy development, which is one of your passions, as you point out, where you specifically target the needs of vulnerable populations. There's a thing called proportionate universalism. Now, proportionate universalism is everybody gets the best, but you put more emphasis, more investment, more energy into those that need it more. So it's universal, but proportionate. I think it's a very attractive concept.
Lovely. Now, it has been great talking to you, but unfortunately, our time is coming to an end. But before I let you go, just one last question. What are 3 things you would tell your younger self?
Right. Well, first of all, I'll tell them to listen to this podcast, because I've said, I mean, it's been a great opportunity, and it's been a nice way to reflect and share and possibly provide some helpful information to others. So the podcast has been a great experience, and I appreciate the opportunity. But if you want me to give you a couple of takeaway grabs, so to speak, here's a couple, maybe more than 3. Teamwork is central to productivity and achievement. 1. 2, in healthcare, embrace both the science of medicine and the human element, the art of caring, of communicating, engagement, compassion, and empathy. 3, open your minds to the wealth of opportunities ahead of you, including leadership in all its forms. 4, remember that a good leader, and indeed I would say a good person, manages to balance being strong with being humble and vulnerable. And lastly, I would say the health and well-being of children is a powerful determinant of the future of society. So children first and foremost.
Some truly great piece of advice. Thanks for tuning in, guys. Thanks for listening to the first ever Bedside Murmurs podcast. If you have any other guest recommendations, feel free to chuck them in the comments below or email us at podcast@medsoc.org.au, and we will see you guys next time.